Health is a huge part of our economy. As most of you probably know, it's about 20% of our GDP. And my favorite stat about our healthcare system is that if the healthcare system in the US were its own economy, it would be the 6th largest economy in the world. So we spend a lot of money on health in the US. It's also the single largest category of employment in the US. So one thing that means is that it employs, the healthcare industry employs far more than just practicing physicians. Lots of people doing lots of different jobs. A whole slew of health economists are employed in all sorts of government agencies trying to understand health policies. We have a colleague in our econ department who teaches health, Sarah Markowitz. She refers to the Affordable Care Act as the Health Economist's Full Employment Act. So that's because it changed almost every aspect of our healthcare system in the US, and that is difficult for people living in the system, but rewarding for people studying the system because you're never out of questions. So a ton of health economists are in all sorts of policy groups now. They always have been, but even more now in health. Another area that is big in health is hospital mergers. So there's been a ton of hospital mergers over the past 20 years and a ton of consolidation in healthcare. That's extending now even to vertical integration between hospitals and other physician agencies. And antitrust authorities, Department of Justice, Federal Trade Commission, they're all interested in what these effects are going to be, so they employ economists to help predict the effect of a merger. What's interesting about that is not only the deep kind of industrial organization theory that you have to do and the data work you have to do, but you're trying to predict the effects of something before it happens. So that's kind of a hard thing to do. And they need economists to help them understand what is the price effect of these two hospitals merging. If they're instead of two, they're one, how much higher a price is going to be? How much lower is quality going to be, if at all? And one thing that I'll just close with here is that the common theme among all of these different careers that we've talked about in economics is that you have to take two things and combine them into one. One is good economic understanding and kind of foundations of how people behave and how firms behave. And you have to couple that with a ton and increasingly more and more data. Right? You have to have both to be able to sell something compelling to a firm or a policymaker. And that's one real benefit of an economics major.